So here the first question is, the nurse is caring for a child recovering from a tonsillectomy. Which fluid or food item should be offered to the child? In this question, there is a nurse who is caring for a child that is recovering from a tonsillectomy. So, after tonsillectomy, which fluid or food item should be offered to the child? So, here, first of all, what is tonsillectomy? The tonsillectomy is the removal of the tonsils. Here, you can see the tonsils. This one is both sides the tonsils are located, and if we talk about the tonsils are the oval shaped pads of the tissues located at the back side of the throat. Here you can see at both sides these are the tonsils. If we remove these tonsils, it is termed to be as a tonsillectomy. And what are the functions of these tonsils? Tonsils can stop the entry of the germs in the body through nose or oral cavity, and it also helps to kill the germs. So these are the functions of these tonsils. And why tonsillectomy is performed? It is usually done for the treatment of chronic infections of tonsils, and if there is any obstructive sleep apnea, or in case of otitis media like conditions, there is a need to be removal of these tonsils. So it is termed to be as a tonsillectomy. In some cases, there is an inflammation of these tonsils, and this inflammation is called tonsillitis. If there is any inflammation of the tonsils can be seen, it is known as to be tonsillitis. So here you can see this one is the normal tonsil, this side is a normal tonsils, and this is a swollen tonsils, that inflammation of the tonsils. So this condition is termed to be as a tonsillitis. The condition is called tonsillitis if there is any inflammation or swelling in the tonsils. So why tonsillectomy is to be done? There are several reasons for performing tonsillectomy. If we talk about the reasons behind tonsillectomy, if tonsils causing difficulty in breathing during sleep, and this is often seen as frequent snoring, so we can remove the tonsils by tonsillectomy. And the second one is recurrent throat infection, means if there is a throat infections that keep coming back 6 or more times in a year with infected and swollen tonsils, then there is a need to removal of the tonsils. And if there is chronic infections of tonsils, then we can also perform the tonsillectomy for a client. Tonsillectomy can be performed under general anesthesia, and this surgery can take 20 to 30 minutes to perform, and during tonsillectomy rose position is given to the client. So this is a rose position giving during the procedure tonsillectomy, and in rose position, in it patient lies supine with the head extended by placing a pillow under the shoulders, as you can see in the picture that this is a rose position, and in it patient lies supine and head is extended, and pillow is placed under the shoulder. So this position is given during the tonsillectomy. What can we do after the tonsillectomy, after the procedure tonsillectomy? So after tonsillectomy, pain is common, and it may get worse 3 to 4 days after surgery. For reducing the pain, we can prescribe the pain medication to the client to reduce the pain after the surgery. And the next one is we can keep watch on bleeding from the nose and the mouth. We can observe a client for bleeding. And the next one is keep check on vital signs like pulse, respiration and blood pressure. And the next one is about the diet. After tonsillectomy, give the clear cool diet to the patient, and when the patient is fully recovered, then give liquids like cold milk or ice cream, and give the plenty of fluids to the patients after tonsillectomy. So according to the question, Which fluid or food item should be offered to the child after tonsillectomy? So for the correct answer, let's move towards the options. Here the option first is green gel O. So what is gel O? If we talk about the Jello, it is a name used for a soft colored sweet food made from gelatin, sugar and fruit flavoring agents. And as we discussed after tonsillectomy, clear cool liquids or fluids should be administered to the child. So gel O contains soft and cool agents. So here we can prescribe the gel O to the child after tonsillectomy. And the second option is cold soda pop. It is a carbonated drink, and after tonsillectomy, carbonated drinks and citrus and extremely hot and cold liquids need to be avoided because they may irritate the throat. So cold soda pop is avoided after the tonsillectomy. So this is the incorrect option here. And the option third is butterscotch pudding. So it is mainly made up of milk, and if we talk about the milk and milk products may increase the mucus secretion and they coat the throat and cause difficulty to child for cleaning the throat. So here the items made of milk and milk products should be avoided after tonsillectomy. So here we cannot offered butterscotch pudding to the child after tonsillectomy. And the next option is cool cherry flavored Kool-Aid. If we talk about the Kool-Aid, it can be available in powder form, that is red cherry color, and it will be mixed with water and some ice cubes. So it gives the appearance like of red liquids. So this type of red liquids are need to be avoided after tonsillectomy because they give the appearance of the blood if the child vomits. So these cool cherry flavored Kool-Aids are also not offered to the child after tonsillectomy. So here, according to the question, the right option is gel O. The green gel O is prescribed or offered to a child that recovering from a tonsillectomy. Now here you can see this one is gel O, that is a cool and soft agent that can be prescribed after tonsillectomy, and this one is cool cherry flavored Kool-Aid, and this is a butterscotch pudding. So according to the question, the right option of this question is gel O is prescribed for a child after tonsillectomy. Now the next question is, the nurse provides a class to new mothers on newborn care. When teaching cord care, the nurse should instruct mothers to take which action? So according to the question, in this question the nurse provides teaching to the class of new mothers about the newborn care, and when teaching about the cord care, the nurse should instruct the mothers that which action to be take while providing cord care. So which action the nurse should take when she will provide teaching about the cord care of newborn. So first of all, what is cord care? Cord care is the series of steps applied in handling the umbilical cord after delivery of the newborn. And how do the cord care perform? First of all, cut the umbilical cord. Here you can see this is the umbilical cord, and cut the umbilical cord. When baby is born, the length of the umbilical cord is about 45 to 50 centimeter. After that, cord is cut when pulsation felt stop, that is after 2 to 3 minutes of the delivery. And after cutting, clamp the cord. Here you can see this one is the clamp is applied to the cord because umbilical cord provides 80 to 100 ml of the blood to the baby. So wait for 2 to 3 minutes. Then after that we can cut the cord of the baby and apply the clamp to the cord. And after cutting, the cord stump will remain. Here you can see, after clump, here is a stump may remain, and that stump shed off between 7 to 14 days. And mainly this stump is clean with 70% alcohol, and 70% alcohol is used to clean the umbilical cord, and clean the umbilical cord 2 to 3 times in a day. Now there are few steps that should be followed during the cord care. Here the first one is lift the cord. After that, wipe the area around the cord. And the third step is clean the base of the cord. And after that, fold the diaper below the umbilical cord to allow the cord to air dry and prevent contamination from urine. These are the few steps that should be followed while providing cord care to the newborn baby. So according to the question, nurse should provide which instructions to the mother about cord care? So for the correct answer, let's see the options. Here the option first is, if antibiotic ointment has been applied to the cord, it is not necessary to do anything else to it. So if we talk about the antibiotic ointment, mainly the antibiotic ointment is normally applied to the cord. Only 70% alcohol is used to clean the cord. So nurse should not provide this instruction to the mother, because cord is only cleaned with 70% alcohol, not with an antibiotic. And the option second is, all that is necessary is to wash the cord with antibacterial soap and allow it to dry once a day. Do not apply soap or water to the cord. The cord should be kept from getting wet, so cord should remain clean and dry. So this option is also an incorrect one here, because we cannot apply any antibacterial soap and water to the cord. And the option third is, apply alcohol thoroughly to the cord, being careful not to move the cord because it will cause pain to the newborn infant. So alcohol is applied to the cord, but newborn infant does not feel pain in that area. We can apply alcohol, but newborn is not feel pain in that area. So this option is also incorrect here. And the option 4 is, apply the prescribed cleansing agent to the cord, ensuring that all areas around the cord cleaned 2 to 3 times a day. So here this option is the right one here. As we already discussed, we only applied the agent that is prescribed for cleaning the cord, and the area around the cord should be cleaned 2 to 3 times a day. So this option is a correct one option here, that we can firstly we can apply the prescribed cleansing agent to the cord, and after that we can clean 2 to 3 times a day the cord. So this is option 4 is the right option here. Now the next question is, the nurse monitoring a preterm newborn infant for manifestation of respiratory distress syndrome should assess the infant for which manifestations? Select all that apply. So here in this question, the nurse monitoring a preterm newborn infant, preterm newborn infant means who born before 37 weeks of gestation, and the nurse monitoring this preterm infant for manifestation of respiratory distress syndrome, that is RDS. So, what is a respiratory distress syndrome? Mainly, it is a breathing disorder in newborn caused by immature lungs. What manifestation should the nurse assess in newborn with the respiratory distress syndrome? So, select all the options that are applied here to this question. If we talk about in detail about the respiratory distress syndrome, respiratory distress syndrome is caused by the baby not having enough surfactant in the lungs, and the surfactant is a liquid made in the lungs at about 26 weeks of pregnancy. As the fetus grows, the lung makes more surfactant, and this surfactant coats the tiny air sacs in the lungs and helps to keep them from collapsing. So, surfactant production start around 20 weeks of life and peaks at the 35 weeks, and any neonate less than 35 weeks is prone to develop respiratory distress syndrome because surfactant in that infants, they are unable to make a proper surfactant to keep their lungs inflated. So, in respiratory distress syndrome, the basic abnormality is surfactant deficiency. So, surfactant is a lipoprotein that contains phospholipid produced by alveolar cells of lungs and helps to reduce the surface tension in the alveoli. As surface tension increases, there is a collapse of alveoli can occur. Here you can see in this picture, this is the airway and these are the lungs of an infant, and as we discussed, it is a normal alveoli, and in respiratory distress syndrome, as there is a lack of surfactant present in the lungs of the newborn baby. So, if lack of surfactant is there, then surface tension increases. So, this increased surface tension may lead to the collapse of the alveoli. So, here you can see this is an image of normal alveoli, and this is the collapsed alveoli that may be seen in the respiratory distress syndrome. And this respiratory distress syndrome is more common in premature babies, and it is usually develops within first 24 hours after birth. So, according to the question, what are these clinical manifestations of respiratory distress syndrome that can be seen in a preterm newborn infant? So, to find out the right one options in that question, what are the clinical manifestation of respiratory distress syndrome? Let's take a view to the options. Here, the first option is cyanosis. If we talk about the option first, that is cyanosis, and the cyanosis is the bluish discoloration of the tissues. So, in respiratory distress syndrome, cyanosis can be seen in central and peripheral tissues. It may be seen in respiratory distress syndrome because of increased oxygen extraction by the tissues. So, cyanosis can be seen in the respiratory distress syndrome. And the second option is tachypnea. Tachypnea means increased in the respiration rate. In respiratory distress syndrome, it is a common manifestation that there is an increase in the respiration of the newborn infant. So, this is also a correct option here. And the option third is retractions, that is chest retractions, and it can be occur in infant with the respiratory distress syndrome due to reduced air pressure inside the chest. So, it is also seen in respiratory distress syndrome. And now the fourth option is nasal flaring. If we talk about the nasal flaring occurs when the nostrils widen while we breathe, and it is a sign of trouble breathing. It is seen in the respiratory distress syndrome that when the nostrils widen while breathing. So, trouble breathing may indicate there is a respiratory distress syndrome in the newborn infant. So, this is also a main manifestation of a respiratory distress syndrome. And the next option is acrocyanosis. If we talk about acrocyanosis, so in acrocyanosis there is a bluish discoloration of only peripheral parts, that is hands and feet. So, as we already discussed that in respiratory distress syndrome there is a cyanosis can be seen in central as well as peripheral part, not only in the peripheral parts. So, this is an incorrect option here because the cyanosis not only seen in the peripheral part. Next option is grunting respiration. Grunting respiration, first of all we talk about the grunting sound. What is grunting sound? It is a short and deep sounds heard at the time of the exhalation. So, grunting respiration, a grunting sound can be heard each time while the person exhales, and this grunting is the body's way of trying to keep air in the lungs, so they will stay open. And this grunting respiration is also a sign of respiratory distress syndrome seen in the infants. So, here this is also a correct option here that is applied to the question. Then according to the question, what are the main manifestation of respiratory distress syndrome? So, here cyanosis, tachypnea, retraction, nasal flaring and grunting respiration can be seen in the respiratory distress syndrome. So, these all options are applied here except acrocyanosis. Now, the next question is, the nurse assessing the apical heart rates of several different newborn infants notes that which heart rate is normal for this newborn population. So, in this question, the nurse is assessing the apical heart rates. The apical heart rate means it is a heart rate that is assessed on the side, that is on the left side of the chest over the apex of the heart, that is at the fourth intercostal space in less than 3 years of children, and at the fifth intercostal space in adults or children's. And the doctor might palpate or listen to the apical pulse or heart rate when evaluates the heart health. So, the heart rate or pulse rate is an important indicator of health, and the apical heart rate is mainly found at the left center of the chest just below the nipples. So, according to the question, while assessing the apical heart rate of several different newborn infants, which heart rate is normal for the newborn population? So, the normal heart rate of newborn infant is 120 to 160 beats per minute. So, what is the correct answer of this question? So, let's move towards the option for the correct answer. And here the first option is 90 beats per minute. As we discussed, the normal heart rate of newborn infant is between 120 to 160 beats per minute. So, 90 beats per minute indicates bradycardia, that the heart rate is less than normal. So, this option is incorrect one here. This is not a normal heart rate of newborn infant. And the option second is 140 beats per minute. Here 140 lies between 120 to 160 beats per minute. So, 140 beats per minute is an average heart rate of newborn infant. So, 140 beats per minute is a correct one option of this question, because the normal heart rate of newborn infant is 140 beats per minute. And the option third is 180 beats per minute. So 180 beats per minute, and option 4 is 190 beats per minute. 180 or 190 beats per minute indicates increase in the heart rate than the normal level, and it indicates the condition tachycardia. So these both options are incorrect one here. Here the right answer is 140 beats per minute. That 140 beats per minute is the normal heart rate of newborn infant. The correct one answer is option 2, that is 140 beats per minute. Next question is, the primary healthcare provider prescribes a dose of intravenous potassium chloride for a client. When administering the IV potassium chloride, which action should the nurse take? According to the question, the primary healthcare provider. Here, the primary healthcare provider prescribes potassium chloride intravenously for a client. So, which action should the nurse take while administering the potassium intravenously? So, first of all, potassium chloride plays an important role in maintaining the health of kidneys, heart, muscles and nervous system. So the potassium chloride is very irritating to the veins, and it must be diluted to prevent phlebitis, that is inflammation of the veins, and administered using an intravenous pump. So according to the question, which action should be taken by the nurse while administering potassium chloride intravenously? So, to find out the correct one option of this question, let's move towards the options. Here, the option first is inject it as a bolus. If we talk about the option first, potassium chloride is never administered as a bolus injection, because it can cause cardiac arrest in the client. So potassium chloride is always give slowly. So this is the incorrect option here. And the option second is use a filter in the IV line. A filter is not necessary for potassium solution. So this is also an incorrect one option here. And the next option is dilute it per medication instruction. This is a correct one option here. This is there is a need to dilute the potassium chloride injection as prescribed or instructed by the physician. So this one is the correct option. And the option 4 is apply cool compresses to the IV site. So the cool compresses should not would constrict the blood vessels. If we apply cool compresses to the IV site, it can constrict the blood vessels, and which could be more irritating to the vein. So we can avoid to apply cool compresses to the IV site. So this is also an incorrect one option here. So here the action taken by the nurse is the right according to question is option third, that is dilute it per medication instructions. So this is all about the today's session. I hope you all liked the video. Stay tuned for the next episodes of questions, and who are new to the channel, go to the channel's playlist to watch previous episodes of questions. Thank you for watching.